partners in crime in the fight for gender equality and women's rights in the region. We're very, very grateful, and we do welcome you to this important virtual conference and presentation of our landmark report, Standing Up to the Challenge, Response to the COVID Pandemic in Asia and the Pacific. This report, published by the UN Women Regional Office for Asia Pacific, tells the story of how the gender impacts of COVID permeated the region and how UN Women and our many partners scaled up its efforts for gender-responsive social protection to help us build back more equally and better. Among the many highlights from this unprecedented year includes what actions UN Women took to secure access to emergency hygiene and other supplies, sustain life-saving essential services for escalating cases of violence against women and girls, integrate gender into national and international crisis response strategies, and make women's economic empowerment, both in terms of paid and unpaid labor, a fulcrum of resilience and recovery. As you'll hear from many of the panelists today, the report also includes illustrative case studies and proposes valuable lessons learned and strategic entry points to mitigate further socio-economic impacts for women and girls for right now and in the days to come. The outbreak of this virus has hit women in the Asia-Pacific region hard, particularly the most vulnerable, and it has deepened pre-existing inequalities, exposing vulnerabilities in social, political, and economic systems. One of the most important contributions UN Women Asia Pacific made during the early days of this healthcare crisis, setting the stage for much that would follow, was the publication of the world's first comprehensive report on the gender impacts of COVID, Unlocking the Lockdown, the gendered effects of COVID on achieving the SDGs in Asia and the Pacific. 1 week after the pandemic was officially declared, the UN Women team began rolling out surveys to gather information from thousands of citizens across the Asia-Pacific region. The survey reached 27 million people to see how the pandemic was affecting their lives and livelihoods. This provided much of the region's and the world's earliest credible data and analysis on the fallout on women and girls, using rapid assessment surveys through mobile phones. The findings of this report were made available to help guide policymakers in the responses. This early report revealed in data what we have all been seeing in the course of our work, that the pandemic had taken a disproportionate toll on women and girls, not just to physical health, but to psychosocial and socioeconomic health as well. The industries hardest hit by the pandemic, leisure, hospitality, education, healthcare, and education, are disproportionately female-dominated. Disruptions, including movement restrictions, removed the ability of many women to meet their families' basic needs. To be truly effective, responses to the COVID crisis must fully integrate gender into every aspect, through strategies that uphold the rights of women and girls and meet their distinct needs. As a champion for gender-responsive planning, both within the international and humanitarian communities, and through strong partnerships with national governments and CSOs, UN Women used this data as a starting point to help integrate gender in response plans, strengthen the quality of plans through better data and training, and jumpstart the process of defining priorities for women and girls in the longer-term recovery stage. UN Women has led advocacy for social protection that cushions the pandemic's blows for women least equipped to cope, which has sustained hope and momentum for recovery. UN Women has also brought unprecedented attention to women's burden of unpaid care work in homes and families, a long-standing issue in Asia and the Pacific that is finally gaining the visibility it deserves. In our work towards moving the needle to a more gender-equal world, UN Women also rallied partners in both public and private sectors to amplify the call for more women's participation and leadership in all decision-making in economic recovery measures. For stimulus measures to be successful, they must do more than just assist major corporations. They have to reach workers and the small and medium-sized businesses that are the engines of the region's economy and which are disproportionately helmed by women in many sectors. Now is the time to ensure that gender equality is fully entrenched in our long-term recovery to build the more equitable and resilient societies we'll need as we emerge from this crisis. In the region, we have also had to confront an increase of violence against women and girls at home. Women who already amongst the most affected by the socio-economic crisis have been suffering from a second shadow pandemic of violence. For many women, social distancing during lockdown meant being trapped in their homes with their own abusers. To respond to this, UN Women work tirelessly apply its experience and resources to advance a gender-responsive approach to meet the most urgent needs of the most vulnerable, while also supporting innovative research to tackle underlying inequalities and equities going forwards. Our mission, as always, is to strengthen systems to build back better, improving access for survivors to services, raising awareness, disseminating guidance and recommendations to governments and humanitarian actors, and helping to shape services to respond through technology or through remote support options. There has never been a greater need to communicate about violence against women to ensure the targeted messages reach women and girls. Our overarching message is that we must treat services for women who experience violence as essential. At the same time, we have had to address the growing trend of misogyny and harassment in the digital sphere. Our analysis of social media suggested that as COVID lockdowns push more people online, digital platforms and online spaces have been increasingly used to spread sexist, inaccurate, and dangerous rhetoric about women, inciting hatred and potentially provoking violence both online and offline. This is why we have worked with governments, development organizations, researchers, and technology companies in the region to build the capacity of women to identify, report, and block hateful content and build social media literacy and counter disinformation in a series of successful campaigns. We have also developed guidelines for media professionals to help them report on issues of violence against women and children. Accurate and sensitive media coverage can help survivors, at-risk individuals and their communities find available resources, and while spotlighting and addressing underlying harmful social gender norms and practices that enable and cause this violence. As you'll hear about in greater detail, UN Women work closely with nations in region to take bold and unprecedented actions to mitigate the adverse impact of COVID, announcing far-reaching monetary, fiscal, and structural measures applied with a gender lens. We have urged governments to put funding in the hands of women who need it most and worked with financial institutions to development banks to ensure the continued commitment of resources to help mitigate the effects of the pandemic, supporting fiscal stimulus programs that are targeted to women and women-focused civil society organizations. There's so much work to do, but I hope you will be encouraged by today's talks and hearing about how we took this pivotal opportunity to rise to the challenge of a generation, remaining resilient during these difficult times, to build a more equitable future together. I'm honored to welcome you to this meeting and look forward to today's discussion. And now I would like to hand over the floor to our spotlight speaker, Smriti Aryal, UN Women representative in China. And thank you. To you, Smriti.
Thank you, Mohammed. And good morning from Beijing, everyone who have logged in. On behalf of UN Women China, I would like to thank you for the opportunity to share our perspective and for everyone who's tuned in to listen and to participate. I've been asked by my colleagues in the regional office to highlight in 3 areas of our work. One is personal journey as a country that was first hit by COVID, as well as what we've done from a management aspect, and the third in terms of our programming. So I'll begin with the personal journey. I mean, I was in Beijing when we heard of COVID hitting China, and that was in late January. Fortunately, we are in a country, and I feel very privileged and lucky that the government here took swift action, and it came at a time when the entire country was about to celebrate the Chinese New Year, a few days ahead of the massive leave. And maybe many of you know that on average in China, more than 10 million people travel to visit their family members and loved ones during the Spring Festival. And if swift action were not taken, it would have been very, very detrimental. So in that case, in that sense, we were very lucky that the government imposed immediate lockdown and the office went on leave. Most of us were on leave. But it did create anxiety and sleeplessness because there was very little known about COVID. There was a lot of rumors. There was many unknowns. I mean, we are still discovering so much about the COVID, including new variants, the work of a vaccine, and it created anxiety and sleeplessness among the team and also for me and my family. And I guess at that point, China was the only country hit. So the understanding on how it would turn out to be the global pandemic a few months later wasn't really seen and viewed or perceived. And that in that way, we felt a bit disconnected and felt that there was lack of global solidarity. But because the office, including the whole of the United Nations, was very quick in responding to start thinking about the duty of care, we quickly moved on to look at staff safety. And that's the second aspect I would like to highlight. So the first important thing was to make sure our team members were safe. Many of them were visiting their family members to make sure they were safe. We started daily check-ins. We made sure staff member had access to masks, hand sanitizers. The office later on, put in measures to reimburse taxi for people who had to eventually return to work. And we offered flexible working hour. And in fact, we are still continuing with handing of mask, sanitizers, and other support to staff member. And of course, working with the whole United Nations system here in China, alongside our UN sister agencies, we also helped establish GVB referral services for staff members who may have been personally affected by growing violence and abuse at home. So, and the UN also took efforts towards psychosocial service provision by working with local hospitals and advocating within the entire UN to make sure that these would be covered under our health insurance offered by the UN. So a lot of internal arrangement. I think a lot of the work that China did for its staff later on became a gold standard on how the UN would engage in ensuring the staff safety. The third area is, of course, what we did programmatically. And in here, I would like to say that our effort revolved around 3 areas. The first one was to amplify advocacy and actions to ensure women's and girls issues were not neglected in the COVID response in the country, and that their voice and participation were promoted and acknowledged. The second was to ensure that our ongoing programs for women and girls could be delivered without interruption, even if it meant operating at a basic level because we were in a lockdown situation. And the third was to actively and urgently look for new partnership and programs to address COVID impact on women and girls. And we quickly did this, and I'm very fortunate to have an excellent team at UN Women China here. We quickly did this together with our partners, women's organizations, academics, experts, government, UN partners, and civil society to assess what the initial situation was, because that was the only way to gather information at that point, was to call, to do survey, and Mohammed spoke on those surveys as well already. And then we fully engaged through the UN for the whole of the UN approach as one UN on a lot of these public awareness raising on prevention, reducing stigma and discrimination, and promoting women's leadership and participation. And of course, we actively did outreach to our donors, to implementing partners, to our strategic partners for joint advocacy. I would like to highlight some of the results we have achieved because of these efforts. Within the first 2 months since the emergence of COVID-19 epidemic in China, and at this point it was only an epidemic, we partnered with the UN system to organize 3 campaigns, and that actually took place within the first 6 weeks, and we reached billion people. Yes, billion people. I had a colleague ask me whether it was really billion reaching only in China or outside, but we reached billion people. And I believe our office was the first one globally to promote women's leadership and contribution in COVID-19 response and recovery through international social media campaign, a message tour, and also framing around the generation equality, and which we launched on March 8, 2020. And that was 6 weeks after the epidemic was announced in China. And we reached over 56 million views, and it sparked 38,000 online discussion in social media timing, gathering attention to the issue of gender dimensions of COVID impact on the lives of women and girls. We also did numerous activities in amplifying advocacy through communications. I've written a number of op-ed, participated and engaged in a number of policy dialogues, basically translating what came from the global level as well as from regional level to country level activities. The good thing about China is that the online communication platform is extremely vibrant, and there are, in my view, it is perhaps one of the fewer countries in the world where we see so much discussion and debate on gender issues. And I have to acknowledge the very important political commitment the government of China has shown in really harnessing the potential and the real contribution made by women, whether it's All China Women's Federation, President Xi spoke about this, and there has been a national level honor given to women who have been at the forefront of the fight against COVID-19. All China Women's Federation published a booklet of women's contribution and set up a remarkable exhibition demonstrating ways in which Chinese women have contributed to this issue. I think this is quite unprecedented, and I don't know if this has been done something like this has been done elsewhere. But in my view, this positive portrayal of women's leadership and the use of empowerment framework is extremely important. It is important because it shifts focus from seeing women as vulnerable and passive to active agents of change whose dedication, leadership, resilience benefits the whole of the society. It also helps demonstrate the power each woman and women collectively have to make the transformative impact in changing people's lives. Of course, it doesn't mean that women are not vulnerable and that COVID has not exacerbated gender inequality. This is true globally. It certainly is also true in China. In particular, as Mohammed highlighted, the issue of unpaid care work and gender violence is a serious one. And in that regard, we partnered with the ILO, FAO, UNAIDS, UNICEF to launch another campaign called Share the Care, and that reached 1.3 million people and generated over 1,500 social media discussions and reshare. And it was aimed at highlighting the extraordinary burden of care that women carry at home because of the lockdown, which has been exacerbated because of the lockdown, but also what men and family members can do to share. And in recognizing the problem, redistributing and reducing the household duty on women. We also, of course, addressed the shadow pandemic and call for actions to end violence against women, aligned to the political engagement strategy of the Secretary General. This has been a nationwide campaign reaching more than 8 cities with iconic landmark buildings being lit orange, and a huge traction from the major news agency in China. In the area of women's economic empowerment, we have been working quite a lot with private sector organizations who have already signed WEPs to implement these standards in the workplaces. so that they would be more friendly, safer, and secure for women. We also organize online trainings, numerous of them, for business leaders and business owners to build their capacity on using technology for business continuity, as most companies and businesses had to adapt to working in a remote setting for the first few months since China was hit by COVID. In addition to this, we launched a new partnership with Rockcheck Foundation that particularly aims at supporting women-led SMEs recover from economic impact on their businesses and build their capacity to prepare to build their capacity for future preparedness by putting in place contingency and preparedness plan to minimize the harm and impact felt. In addition to do this, of course, China as a country that has really supported globally in the COVID response through South-South collaboration, we, with the support from the regional office, we organized the interministerial high-level meeting that brought all China Women's Federation, key policymakers and decision makers in China, along with senior government members from Africa, Arab, and Asia regions to discuss policy options and come into agreement on how to address the socioeconomic impact of COVID-19 on women and girls everywhere. These are, of course, just some of the highlights, and I believe I'm running out of time. Of course, these are some of the things we have done, and we recognize the needs are much bigger than our efforts. And we also realize that we need to continue working harder. We need to work smarter and with greater sense of urgency. The key in all of it is that none of this could have been achieved alone if we were doing this alone. In that regard, we need partnership from everyone and to really bring the tangible and transformative impact that we always talk about. So with these final thoughts, I would like to thank you once again for the opportunity to share our experiences, and let me also take the opportunity to wish everyone a happy Lunar Chinese New Year, the Year of Ox, which begins tomorrow. Thank you. 谢谢.
Thank you so much, Smriti, for sharing your reflections. Actually, it's great to start with you because your early leadership really did set the tone for UN Women's COVID response in the whole region. So my name is Sarah Nibs. I'm the Deputy Regional Director of UN Women here in Asia Pacific, and I'm really honored to be introducing and moderating our panel this morning. As we've already heard, UN Women has really been working since the very start of this pandemic to try and address the challenges faced by women and girls. From the beginning, we knew from the experience of past disasters that women and girls would likely be disproportionately impacted across all spheres and domains. And I'm really delighted that we have a panel this morning that will be able to very richly reflect some of the different dimensions of the work that we've engaged with. So I would like to begin by introducing our panelists for this morning. To begin with, I'm very pleased that we have Sara Duarte joining us. She is our regional expert in gender statistics based here at the regional office in Bangkok, and she's part of the Global Women Count project. Secondly, joining us from UN Women in Papua New Guinea, we have the Deputy Country Representative, Caroline Yamea-Mombe, who will share experience from working in that context. Thirdly, we have Navanita Sinha, and she is a program specialist with UN Women in Nepal. We also have Shoko Ishikawa, who is our UN Women representative in Bangladesh, and who will also be talking about the work in Cox's Bazar. And finally, I'm very pleased that we have Rais Chanchai, who is our program specialist on gender and government based with UN Women in Indonesia. So I would like to begin to open the floor for our discussion. We will begin with one question for each of our panelists, but I'd like to remind you that you can all use the Q&A chat to ask more questions, and we will try to answer as many of those as we can during the Q&A session after the panel. So first, I'd like to turn to Sara Duarte. So before we really delve into the report and the different actions that the countries have taken, we would really like to hear a bit more about the latest data and statistics. So Sara, can you tell us, what are the latest findings on COVID-19's gendered impacts here in our region?
Thank you so much, Sarah. So let me quickly try to show some graphs on this so that I can walk everybody through the findings. Sorry, just 1 second. I think you should be able to see my screen now. Okay, so what do we know and how do we know this, right? So right when the pandemic began, one of the first things that we noticed as statisticians was that we had to interrupt global data collection. All statistical operations were interrupted globally because obviously we couldn't go face-to-face, we couldn't collect data face-to-face, we couldn't go door-to-door to run our usual surveys and censuses. So since then, UN Women has collected data on the consequences of the pandemic on the lives of women and men using different modalities. So we have distributed surveys via SMS. We have done phone enumerated surveys. We have collected data in partnership with digital platforms by sending push notifications to merchants working on the platforms. And we have done big data analysis. And the findings of all this data collection are reflected in 4 separate publications, which are listed here. So the key findings of 2 of these publications are also included in the report we will be discussing here today. So I will quickly walk you through some of this. So the first thing that we did when the pandemic hit, as Mohammed initially mentioned, we ran surveys in 11 countries to see what were the immediate consequences on the lives of women and men. And very shortly after the pandemic was declared, we saw that we were already seeing very differentiated consequences. So women told us that their mental health was being disproportionately affected compared to what men said. We saw that more women than men noted increases in the intensity of unpaid care and domestic work, for instance. And we even saw that areas that we didn't expect to be affected by the pandemic so much, such as the time spent collecting water, actually increased as a result of the pandemic. So we saw across all SDGs, women and men were affected differently. So since then, we are designing and we plan to roll out very soon a second round of the surveys to see whether things have changed, whether they've worsened or improved since the pandemic began. But in the meantime, we have done a zoom in on 2 very specific areas, and we have collected data on 2 very specific areas. One is what's happening to micro businesses, because we know women are disproportionately involved in micro businesses. The second one is what is happening in the area of violence against women. So I will be talking about these 2 types of analysis here today. So for the analysis on micro businesses, we actually partnered with Gojek, the tech giant in Indonesia. And we saw that micro business owners, whether they were on the formal or the informal sector, large majority of them told us that they were seeing drops in revenue, right? Like they were making less money than before the crisis. This was no surprise. However, what was kind of like encouraging is that we saw that digital platforms were really helping some of these micro businesses survive and even expand. So the younger the business, the higher the likelihood that the use of digital platforms was helping the business survive or expand. In addition, we saw that women were more likely to say that the digital platform was helping their business expand, which is very encouraging to cope with some of the effects of this pandemic. Particularly because we also saw that government stimulus programs weren't really reaching these micro businesses. So the bulk of them said that they were not able to access any of the stimulus programs for businesses. And women-owned micro businesses were less likely to be able to have access to these programs, and even more so if they were in the informal sector. So we have a lot more findings around this, and we built this online tool, which you can use to play around by clicking on the link at the bottom of the slide. And you can move the toggles left and right and see how business of different characteristics cope with the pandemic in Indonesia. And we plan to expand this analysis in other countries across the region. Now, moving on to the topic of violence against women, this is an analysis that we conducted in 8 countries in Asia. And this is obviously, we could not include violence related questions in some of our broader phone surveys and online surveys because victims may be currently confined at home with their abusers. So we would be putting their lives at risk. So instead we turned to big data. we analyzed what is happening online. So we looked at online searches, like what are people Googling, for instance, as well as social media posts in the areas of violence against women. And we saw very clearly that the search volume on violence against women related searches really increased between around March to April in most countries. So that's exactly when the pandemic hit, and we saw the increases. In some countries like Malaysia, for instance, there was an increase that has been sustained since. In other countries like the Philippines, there was an increase then, and then the number of searches on violence against women kind of went back to pre-pandemic levels. So we see some differences, depending on the countries in this area. We also see that generally the posts around the posts around online misogyny have increased in every country considered except for Malaysia. They have increased dramatically in countries such as Thailand and the Philippines, for instance. And we also see that posts offering support to victims have increased a lot in many countries, like Bangladesh and Thailand, for instance. We see a lot more posts offering support to victims, but they have actually decreased in other countries, which is a little bit worrisome. We see from the big data also that service providers aren't really reaching all the victims. We see, for instance, that in some countries, when you Google, and when I say Google, I mean search in any of the search engines, not just Google, right? So when you search for things like support services or violence hotline or any related terms looking for help, in places like Singapore, you actually get local services in the top results in your search engine. But in places like Bangladesh, you actually get foreign services from Australia, from the US, which isn't so useful for the local victims. In addition, we see that service providers in some cases are really much more active compared to pre-pandemic levels regarding posts, but they aren't really getting the engagement that they need from all the different victims or survivors, right? So we see clear differences. The posts that are like the one on the left, where they have concrete information such as a hotline or a specific surveys and how to reach it, those get high levels of engagement, while many other posts that show like some degree of sadness don't really get engagement. So some key lessons to think about for service providers in terms of how to reach victims around type of posts and around search optimization. So we obviously have a lot more findings, but I'll stop here because mindful of time. Thank you so much.
Thank you so much, Sarah, for those insights. I think that really helps to set the scene of the context that we're talking about here. Now, all of us are aware that COVID-19 really began as a health crisis. But unfortunately, as we've all lived through, it's spiraled into every area of our lives and every area of the lives of the women and girls that we work with and for. So I'd like to now turn to Caroline to hear a little bit about some of the pivoting of the program that happened in Papua New Guinea. So Caroline, can you tell us about some of the essential actions that were undertaken in Papua New Guinea at the beginning and which leveraged the existing work UN Women was doing and met the very urgent challenges women and girls were facing? And can you tell us as well a little bit about how that linked to the national response there in PNG? Thank you.
Caroline?
Caroline, I think you're muted.
Oh, I'm sorry. Okay, so
Problem.
Good morning, good afternoon again. Can you hear me now? Good.
We hear you well,
so
thank you.
Okay, so in Papua New Guinea, the vast majority of women are actively involved in the production of food or goods, making the marketplace a critical economic hub for them. So with the restrictions that came in with COVID, we were very mindful of what this would do to women's income security and the associated consequences. And true to our assumptions, in June, our rapid assessments did show a 51% decrease in market daily earnings for market vendors. So we quickly focused our efforts around the working markets. And what we did is we leveraged on existing work. And our work dates back to when we started constructing the Gordon Market and upgrading other markets in Port Moresby. Next slide. And here we were able to lead development of a set of guidelines for operating markets safely within this new COVID context and what it required. The guidelines essentially provided local authorities with a set of minimum standards and operational actions for keeping markets clean and prevent the spread of COVID. Simultaneously, we had to provide some initial supplies to these markets, hand sanitizers. We had to also install, some soap dispensers within washrooms, so that at least market managers would really get a sense of what the new norm required. We, as UN Women, are sitting on the, we are co-chairs of the protection cluster in PNG, and that essentially gave us a seat at the National Disaster Management Team. Next slide. And we used this position, in the disaster management team to influence the promulgation of key guidelines for COVID safety that were gender responsive, within the first 3 months. The first one was really the, making the market safe. So the safe market guidelines were eventually adopted as the, as a national measure and were issued out by the State of Emergency Controller in June, making it the golden standard across the country. We also issued guidelines around safe operation of safe houses, and this enabled safe houses to remain operational and to be able to scale up their operations. We also issued guidelines around face-to-face community awareness, because there was some level of movement that was still permissible as restrictions were eased out. So with these guidelines, we were actually able as UN Women to use our work with the vendors association within the markets to pass on awareness within marketplaces, and this awareness targeted both the vendors and the users of the market. We also used our young people's program, the Stand Up One Time youth. They also went around within the markets to raise awareness using various IEC materials. And what this work really did was it enabled us to, work that started off really in the capital in Port Moresby, because now we had all this national level adopted guidelines and ways of doing things. We were able to attract our existing development partner, the Government of Australia, to include us in their new program, which they had developed, which was really focusing on market economic recovery. Next slide. Market economic recovery and inclusion. And within this partnership, what we have seen is a scaling up of the work. And we've been able to expand the work around making markets safe to 14 markets. And it has enabled infrastructure upgrades to ensure that the markets are compliant to the guidelines that were promulgated by the State of Emergency Controller. We've also been able to deepen our relationships with market authorities to ensure that their governance remains gender sensitive. And we've also seen new opportunities of engaging at a national level. So as government started to roll out, operationalizing a stimulus package, the experiences that we already had with economic inclusion of women within the market space have helped us to shape new policies. So we have policies like the social protection policy that had almost kind of died, and now it has been resuscitated. And in 2021, we are actually working with the National Community Development Department to, promulgate a national policy around social protection for the informal sector. So in short, these are some of the key actions that we did, leveraging on the existing work that we had in Papua New Guinea. Thank you.
Thank you so much, Caroline. It was really fascinating to hear, I think, about the very practical measures that you were able to take there to safeguard the lives and livelihoods of the women market traders and their communities. It also became very quickly apparent from the beginning of the COVID-19 epidemic that it unleashed not one, but two pandemics. Domestic violence during the pandemic has been called a shadow pandemic. Actually, unfortunately, many of us working in this area are well aware that in fact, intimate partner violence has always been prevalent. But we know that the COVID-19 pandemic created an environment in which there was an increasing rate of intimate partner violence and where many women were in fact locked up with their abusers. We saw skyrocketing rates of calls to helplines around the region. And as we heard earlier from Sarah, big data reflected many women searching for terms related to violence online as well. So I'd like to turn now to Nepal, where the Supreme Court issued a landmark judgment prioritizing women's rights and the representation of women in planning, managing, and monitoring the national response to COVID-19. This judgment explicitly recommended the gender equality and social inclusion checklist that was developed by UN Women with humanitarian partners to steer the response to COVID-19. So I'm very pleased to have Navanita here. And Navanita, I'd like to ask you to please tell us more about the checklist and the comprehensive relief package that was developed in Nepal. Thank you.
Thank you so much, Sarah, and good morning, colleagues. Thank you for the opportunity to share our work from Nepal. That 2020 was a challenging year would be a clear understatement. We are all aware of the devastating impacts it has had on the lives of women and girls across the world, and Nepal clearly is no exception. Next slide. As we talk about how challenging 2020 has been, it is also important to acknowledge that it has pushed us to think and work differently. In Nepal, we made some important adjustments by adopting a developmental lens to respond to this humanitarian crisis, which means that as we focused our efforts on responding to the immediate needs of the most vulnerable, we also kept a keen eye on anticipating the longer-term effects that the pandemic would have on the lives of women. Our focus, therefore, was fourfold. We sought to first and foremost address women's practical needs as the crisis evolved. We also identified and responded to specific gender-based vulnerabilities. Our third pillar was to support women to recover and sustain livelihoods that they had lost in the aftermath of the pandemic. And the fourth was to continue to invest in movement building and support women's networks for their political engagement. A key innovation that we tried in Nepal in 2020, which brought all these elements together, was the comprehensive package, which is what I will be sharing today. Next slide, please. To address women's practical needs, the package includes both cash and in-kind support. And as you can see on the left-hand side of the screen, the cash support here brings in a very strong intersectional focus. In addition to the basic amount, which was $24 per person, identified by the Common Cash Group in Nepal, we also provided additional amounts for childcare, support for lactating and pregnant women, special provision for women with disabilities, and also GBV survivors. In terms of in-kind support, again, we provided a range of food and non-food items with a focus on responding to diverse needs of women, including energy, digital inclusion through mobile phones and data cards, and special inputs for those engaged in subsistence agriculture. Next slide, please. In line with the second stated objective, the comprehensive package focuses on improving women's access to information. And I'm happy to share that through our PSAs and radio programs, we have reached approximately 8.7 million nationally. Another interesting initiative that we have started is to set up a virtual information desk. And as the name suggests, in addition to providing accurate and timely information to women on COVID-19 and other gender equality issues, the virtual information platform is also helping us build capacities of smaller women's organizations on how to use digital platforms and digital tools for advocacy. With regard to services, we have had a special focus on ensuring and expanding women's outreach to psychosocial support and legal assistance specifically for GBV survivors. As I mentioned, the third component focuses on recovering livelihoods and includes a range of interventions from reskilling to ensuring women's access to e-commerce platforms, provision of seed funds, and this is particularly important as mentioned by Mohammed and Sarah for small businesses that are run by women, and also through specific initiatives that we started at the community level, including women-led and managed community kitchens. Next slide, please. Movement building constitutes the fourth component of our comprehensive relief package, and some of the key initiatives that we took in 2020 was to support 3 women's networks to prepare a charter of demands. And this was used for advocacy by these groups as part of the pre-budget engagement with the government. We also supported and worked with women's organizations and our national women's machinery to develop GESI checklists. And these were used extensively to monitor the quality of services being provided as part of the COVID-19 response. Another key initiative, and rather unique in the context of Nepal, has really been reinvigorating the GIHA platform. This is the Gender and Humanitarian Action Task Team, which has become a unique platform bringing together diverse stakeholders, government, civil society, development partners to keep the spotlight on gender equality issues. And Sarah, as you rightly mentioned, the big win for us in 2020 was the landmark Supreme Court judgment. And if I'm not mistaken, perhaps the only one in the region which talks about the need to put women's rights front and center as part of the national response. This particular judgment references a lot of these initiatives that I highlighted, including the GESI checklist and the contribution of the GIHA platform. On the right-hand side, I've just captured some of the big numbers in terms of our outreach through the comprehensive package. So far, we have reached more than 4,000 women across 5 provinces in Nepal. Next slide, please. In conclusion, I just wanted to share a few lessons. There are so many that we've learned in 2020. Perhaps the most significant has been that we need to be able to take more risks if we have to, through our programming, be responsive and adaptive in an ever-changing context. Our ability to showcase and demonstrate the how, often inclusive, is also very, very critical. And to a great extent, we think in Nepal, we did this with the comprehensive package. And last but not the least, ensuring and being intentional in extending the circle of care, not just to staff, but also to our partners in the field, has been critical to ensure our effective COVID-19 response. I will stop here and happy to take any questions, if any. Thank you.
Thank you very much, Navanita. And indeed, it's really inspiring to hear how the work was reflected in that landmark judgment. Thank you. So to be effective, responses to the COVID-19 pandemic have had to integrate gender in every aspect. And this requires explicit strategies that uphold the rights of women and girls and meet their distinct needs. UN Women has acted as a leading regional champion for gender responsive planning within the international and humanitarian communities, and through very strong partnerships with national governments as well as CSOs. UN Women has worked with these partners to integrate gender and response plans, to strengthen the quality of plans through better data and training, and to jumpstart the process of defining priorities for women and girls in the longer-term recovery stage. In all of these processes, we continue to emphasize the importance of listening to ensure that what is planned as an intervention is actually meeting the needs of women and girls. So now I'd like to turn to Shoko. Shoko, Leave No One Behind continues to be a foundational component of response. Could you tell us what were the important factors for you when you were developing the response in Bangladesh? Thank you.
Thank you, Sarah. I am going to present specifically on one initiative where we have really thought about the Leave No One Behind principle, and this was around the cash distribution, cash assistance work that we did. Through this effort, at the end of the day, we have been able to reach 2,300 plus marginalized women and transgender persons in 5 of the most flood and COVID affected districts in Bangladesh. As you know, in Bangladesh, as COVID outbreak was, of course, a significant event, we were also inundated with floods last year. So there were a number of districts that had to deal with both at the same time. So our efforts on cash distribution also looked at where there was a significant overlap between the COVID impact as well as the flood impact, and focused on these 5 districts. But as we had entered the lockdown, what we felt with in our own planning, in our reprogramming, was really the need to understand what the situation on the ground was. And it was not easy just within our existing network of NGOs. So we did an extra outreach to try and expand the group of NGOs that we work with. And therefore we created something called the Gender Monitoring Network, where we went into seeking out groups that are working at the grassroots level with the marginalized groups that are dealing with intersectional discrimination. So these were sex workers networks, these were groups that were working with sexual minorities, with religious minority groups. So we now have created a network of 28 organizations and network organizations that bring in many NGOs and CBOs. We organized a consultation meeting in April. The lockdown in Bangladesh started at the end of March. So in April, we had a consultation meeting where we were really able to hear the stories of how the initial relief activities of the government were not reaching the people that are most marginalized. We heard stories of sex workers being out on the streets with no food. We also heard stories about the transgender community being highly impacted. The disabled women and the families that are caring for the disabled were not being put onto the list of the government for the immediate relief. So all of this information pointed us into the direction of needing to consult these groups even further. So after an initial consultation with the Gender Monitoring Network, we then directly reached out to some of these particular groups working with these marginalized people. And we asked for a list of who they would recommend, particularly in these 5 most affected districts, for us to reach out to. We connected these organizations with the women's groups that we were working with in these 5 districts through a pre-existing program that we had on disaster risk reduction, where we had 52 civil society, community-based organizations that have been working with us for the past 2 years to support communities that are affected by floods and better reach out to women in the disaster context. Now we were transitioning that into responding to COVID, connecting these groups working with disabled women to the community-based organizations, sharing the lists so that we could identify who were the most in need of the funding. And this is what Mohammed was saying in the very beginning. We were trying to put the funds in the hand of the women and the communities and the individuals most in need. We did this also with the local authorities. The local authorities, we wanted to bring them on board. We wanted them to also endorse the list that we were creating. The women-led CSOs were actually going door to door, verifying the information that received from the other NGO networks to make sure that the people that we are targeting are the ones that are needing the cash most. There was a lot of talk about duplication of the relief. So we want to make sure that the ones that we were helping were the ones that hadn't received any support from anybody else. So the local authorities, the coordination with them to double check on all these matters were very important. And it was also demonstrating to them how to reach out to the most marginalized through making use of the women-led CSOs in the grassroots communities that were able to identify and speak to the most vulnerable women on the ground. So through this effort, we had a beneficiary list. The actual cash transfer then took the form of mobile cash transfers, which is the way that the Bangladesh government overall is trying to move to when they are distributing cash relief. We then made sure that there was a monitoring system in place. There were calls that were made to the target beneficiaries after to make sure that they had received this cash through mobile transfer. In a number of cases, the mobile numbers were in the husband's name, and therefore we had to make sure that the cash transfer that went to the husband's mobile was then getting into the hands of the female beneficiaries that we had intended. There were a number of lessons that we learned in this process. And one of this was around this mobile cash transfer and how we need to not over rely on this method. We always do need to have the ability to give cash face-to-face in the case of trying to reach the most vulnerable woman. And if we completely switch to mobile fund transfer, then there is going to be an exclusion that is necessarily going to be taking place. And this is something that we are advocating with the government now. We also learned that we definitely need to support more women-led CSOs, be able to do this work, and have the support of the local authorities to direct this cash relief work to the women civil society organizations. We also found out challenges of reaching sex workers groups that are in the brothels, because the owners of the brothels are acting as gatekeepers, and they do not want to release the phone numbers of the sex workers, release the national ID card numbers of the sex workers. And there was a lot of negotiation that took place with between the brothel owners and the CSOs that were in the front line. We also learned lessons around transgender communities, and we need a greater dialogue with the transgender community to learn more how we approach them, because we found that they are often in a group home where they would not want to see a particular individual in that group home given cash and not the others. So we need to understand the group dynamics in the transgender groups to be able to better provide cash assistance to transgender individuals. These lessons, we are now trying to work together with the humanitarian country team that does cash distribution at times of emergencies, and try and integrate this approach of really making sure that the most in need are reached into broader cash distribution work, because every year Bangladesh faces disasters, and there is lessons that could be learned for the bigger humanitarian community. So with that, I hand it back to Sarah. Thank you.
Thank you very much, Shoko, for really showing us how leaving no one behind could be put into practice in this humanitarian setting. The economic impact of COVID-19 has been very severe for women in our region, particularly given that many of them were already highly vulnerable because they worked in jobs that were insecure, poorly paid, and informal. UN Women has been advocating for social protection that cushions the blow of COVID-19 for these most vulnerable women, and has also brought unprecedented attention to the issue of unpaid care work, which has been a long-standing issue in our region, but has been very much highlighted by the pandemic. Shoko has just shared one approach to cash-based programming to target the poorest. We will now hear from another experience. In Indonesia, UN Women supported a pilot of an innovative cash for work program that has been designed to provide income generation opportunities specifically for women through production of the essential goods and PPE kits as part of social protection response to COVID-19 that has potential to be scaled up. I'd like to turn to Rice now. Rice, can you tell us about cash-based programming and women's economic empowerment in Indonesia? Thank you.
Thank you very much, Sarah. I hope you all can hear me very well. As a last speaker, I would like to avoid talking specifically too much into details, because here is to give you a highlight and excitement for you to actually go and read our report. In Indonesia, our work on social protection response is the anchor for 3 aspects of our work that I cannot just only look into the cash for work as a single piece, but to look at the comprehensive totality of the 3 angles that we took that place UN Women at the strategic and catalytic entry point to engage in the larger policy dialogue with the government. Start with number 1. on the data innovation and the use of technology that actually has been mentioned by Sarah, and some of the key highlight of the finding. It was important for us to actually start with this piece because the cash for work and the impact of it would be minuscule if we are not able to put the gender consideration at the center of national policy dialogue in the discussion with the government. And here we are horned into two key areas of the government interest. One is how gender and achievement of the SDG will be impacted by the COVID crisis, as well as looking into specifically of the economic transformation agenda of the government, and highlighted how we can actually anchor the national economic recovery response with the greater gender angle and the focus on women-owned micro small enterprises as a form of sustainable recovery. We were very bold and innovative and the first to come up with the most comprehensive evidence and data, combining big data, quantitative and qualitative survey in our work to bring up the use of technology and strategic partnership with one of the largest private sector to actually overcome the restriction that was imposed to us by social mobility and movement that make it very difficult for the National Statistical Office to be able to actually collect the reliable data that actually zooming in the plight of women and girls in Indonesia. And there we partnering with the on-demand multi-services platform, digital payment technology groups such as the Gojek and the big giant telecommunication platform. And here is the second area of work, which is very typical in UN Women across country offices in the region, where we actually have a policy influence in integrating GBV into the social protection response policy discourse. And here we work very closely with UNFPA. And why is it important? Because I think UN Women is virtually the only organization that expand and challenge the definition, the typical definition of social protection, which is generally focused on alleviating economic shock and poverty reduction into looking into social vulnerability that are very gender specific, such as violence. And I will not go into the details here, but just to highlight that it's similar to some of my co-panelists that has been discussing around supporting the safe house and the crisis centers to stay open, to engage with civil society, and to make sure that the focus on women of marginalized groups, such as women migrant workers and women living with HIV, will not be missed. And here is our highlight in redefining the gender responsive social protection program, which is my last and final slides here, is to show you that in general, when we're talking about cash for work program in the larger discourse of social protection, it's always focused on infrastructure development. And here we're challenges the definition and redefine what it means when we look into gender responsive social protection program. And what is important here is not the number of beneficiaries per se, but the challenges of discourse that can provide the government with the prototyping of the model that can work. So we focus on women workers in garment industry who are hardest hit by COVID, with the collective, looking at the collective agreement within the Women's Solidarity and Self-Help Group. And how do we do this? We focus on cash assistance that combine with social enterprises, where we work on value chain and entrepreneurship development program into the production of masks and PPE kits in combination with training and coaching and marketing through UN Women online We Learn platform. And finally, we look into innovative design of the use of technology to provide electronic food voucher assistance, as well as exploring, very importantly, and not very much explored and underexplored, is the linkages between cash assistance and violence at the household level. And here we partner with CARE Indonesia and local authority to hopefully lift it up to the conversation with the government to continue this work and amplify in the upcoming year, as this is going to be a continued collaboration and effort. So with that, I thank you for your attention. Over to you, Sarah.
Thank you so much, Rice. And it was really inspiring to hear about how you really worked on that paradigm shift around what cash for work actually means, and showed that example of how social protection could really work for girls and women in the most vulnerable situations. Thank you. So we've heard from all of our panelists now, and I think we've reflected a number of the different important dimensions of the gendered response to COVID-19 in Asia Pacific. This is now an opportunity to share some questions that some of you have been asking through our Q&A. So I am going to now have a look at those questions and direct them towards our panelists, and we'll see if we can fit in a few before we have to finish. So I think I'm going to begin, if it's okay, by turning to you, Shoko, because I have a couple of questions here about Bangladesh. So Shoko, there's a very interesting question here actually. One of our attendees was asking whether there was any resistance from government or other groups against supporting marginalized people because of social norms, taboos, or discrimination. And I also have another question I'd like to share at the same time for Bangladesh, if that's okay. We were also asked whether you had worked with the Rohingya community as well as with the host community. So I know that you would have something to share around that. So it would be great if you could answer those, please, for us, Shoko. Thank you.
Thank you very much. Yes, let me go with the Rohingya community first. Yes, we've been working in the Rohingya camps for the past 3 years. So we have also shifted our programming to COVID response when the entire Rohingya response also, of course, made adjustments. The government, as the rest of the country went into lockdown, also they had limited access to the camps. So we had to reduce our footprint. We had to have less of our field workers go into the camps. And this is where our network that we have been nurturing of the Rohingya women community leaders, this really came into play. We had consultations with the Rohingya community so that we could collect the concerns that they had in terms of how the response was shaping up and the prevention activities were shaping up. Something that came out prominently was around the fear that the Rohingya women and the families had around isolation centers that were going to be established, isolation and treatment centers that were going to be established in the Rohingya camps. And there were particular concerns around whether the facilities were going to be sex segregated. If they're not adequately segregated, then the Rohingya women will not go to these facilities. So we collected these concerns, the voices of the Rohingya women, and then as us leading the Gender and Humanitarian Action Working Group of the Rohingya response, we channeled this upwards into the health sector, into the site management sector, as them having to pay attention to these concerns so that whatever those facilities that they create, they are not really missing out on the Rohingya women and girls. And this is really a life and death situation, in a sense that even if these facilities are set up, if women are not going to access it, then what are we doing? So we kept on with our role of making sure that the Rohingya women and girls were consulted in all of these steps and measures that the humanitarian community was putting into place. We also shifted our livelihood activities into mask making, for example. We were the first to do that in the camps, and we then shared the know-how with the other humanitarian organizations also. So there's quite a lot of livelihood activities around PPE production and mask making that is going on. So that is what we are doing in the Rohingya camps. Just part of it though, there's a lot more that we are doing. In terms of whether there was any resistance from around social taboos and so on, I think more than the resistance and social taboos, I think there were things that we did not understand well enough, and we learned around how different communities or marginalized communities work. So as I mentioned, for example, if we are to approach sex workers, how are we supposed to understand how they work better, how they organize better, so that we can best approach them and access them. Same with the transgender community. I think it is us that needed to learn more about how to best include them. And it is not necessarily that there is the government's resistance to it. Government is also just treating all of the groups sort of as a homogeneous group, and are not able to pay attention to the unique circumstances of the different groups. And that's where UN Women comes in, taking the gender and intersectionality approach to really understand how to provide the relief and support to the diverse groups of women. Thanks.
Thank you very much, Shoko, for unpacking that for us. I've got a question now that I'd like to direct towards Sarah Duarte. Now, this is a question really focusing on the big data that we were talking about earlier. So, Sarah, could you tell us what are some of the national specificities in the online violence against women and girls related discourse and searches? And do we observe any stark differences in national trends in the different contexts that we looked at? Over.
Thank you so much, Sarah, for this question. I think I would say that we see more commonalities than differences, but there are definitely some specificities. So we see, for instance, in terms of commonalities, we see that, you know, searches for violence against women increase across most countries considered for the analysis. We see that frustration towards the lack of action from government is pretty widespread. Frustration towards national security institutions is pretty widespread as well. And so is victim shaming, unfortunately. But in terms of country specificities, we do see some differences. So for instance, the types of topics that are discussed online are different across countries. So in Nepal and India, for instance, there's quite a bit of discourse around acid attacks. While in the Philippines, for instance, there's much more discourse around things like online misogynist comments, etc. We also see that in terms of support services, we see some difference across countries. So like I was mentioning before, the support services don't always come up in search engines in, you know, across countries. So in Singapore, they have, you know, pretty optimized search engines, and therefore local services come up when you look for help, while in places like Bangladesh, not so much. We also see differences in terms of mentions of vulnerable groups. So we kind of try to zoom in on migrants and how migrants were faring, you know, as a result of the crisis. And we see that in places like Nepal, Malaysia, Singapore, Indonesia, there's quite a bit of mentions of migrants and violence against women migrants. While in other places like Thailand and the Philippines, the discourse is very quiet in this area. So yeah, definitely we see some differences across countries. Thank you.
Thank you very much. Thank you very much for that, Sarah. I appreciate it. Now, I'd like to actually turn to Navanita now, because we have a question from our audience about Nepal. So Navanita, could you tell us a bit more about how the Gender Equality and Social Inclusion checklist that was developed by UN Women with humanitarian partners to steer the response, can you tell us about how that has really informed Nepal's efforts in tackling the gender dimensions of the impacts of COVID-19? Over.
Thank you so much, Sarah, for that question. As I mentioned in my presentation, I think the most important aspect of developing these tools like the GESI checklist has been the collaborative manner in which we've done it. Bringing together all members of the GIHA platform has been key to ensuring that all the diverse needs of different excluded groups are reflected in the tool. The other important aspect in terms of also creating ownership has been to work very closely with our nodal ministry, which is the Ministry of Women, Children and Senior Citizen. And they were very closely involved in actually shaping and developing the checklist. In terms of the response overall, we've seen a very, very positive uptake by women's organizations in using the checklist to monitor quarantine centers in the initial period of the lockdown, but even more recently looking at isolation facilities. Also another important result of our engagement with the government, we've also seen the National Women's Commission actually use this checklist extensively in monitoring the quality of services. So I think two key points in terms of the way in which we developed it in a collaborative and participatory manner. And of course, our engagement with both the women's organizations and the nodal ministry has been critical in taking it forward. So I'll stop there, and if there are any follow-up questions, happy to answer. Thanks.
Thank you very much, Navanita. Right now, I'm going to talk to Rice. We're going to go back to Indonesia. So Rice, we have a really interesting question here. When engaging women's voice with technology, Is there any evidence or experience that it is considered or taken more seriously by stakeholders and local national authorities? So this is really looking at some of the impacts on amplifying women's voices using technology. Over to you, Rice. Thank you.
Thank you. This is a very important question, but not easy to answer because there's a lot of specificities that require in actually or answering that question justifiably. I must say that the exploration of digitalization and gender and how women can amplify their voice and their roles in digitalization in response to COVID is an undercover and underexplored areas. And here, I think our office is taking an exploratory work to shed the light into some of the findings here, but it's not conclusive. It is, why is it difficult to talking about the evidence? That is because there's a vast majorities of different like industries and how people are actually participating and at what point in their business and enterprises or as an individual that they are and can participate in the discussion. I would say though that Indonesia is one of the most lively places on earth when it comes to social media and the use of online platform to be able to participate and amplify the voice of women. And here you have already seen a lot of lively discussions. I guess what we're trying to do here in the country office is to take this lively discussion and this active participation of Indonesian that like, I think 100 millions of people are actually on Facebook, but we have equal amount of people who don't have electricity to actually take it further into how can they actually leverage this platform to access to market, to actually really be empowered economically and socially. And that's, we will have to take it into the specific consideration of which sector we're talking about and where are we talking about Indonesia. It's such a diverse context that if I talk to you about something happening in Java, it might not actually relevant at all to people who are in Sumatra or in Sulawesi or even different diverse ethnic groups. So I apologize for not direct answer, but I find it very difficult to direct it into an areas where require further specificities. Thank you, Sarah.
Oh, thank you, Rice. I think that's actually a really reflective, interesting answer. And you've highlighted the digital gap that we see in many places and some of the really nuanced complexities of that in the context you're working in Indonesia. So thank you. I also have quite a reflective question here for Caroline, focusing on Papua New Guinea. So Caroline, I'd like to ask you, how did UN Women and its partners engage local communities without increasing levels of distress in the population, while equipping them with necessary knowledge and information about the pandemic? Can you tell us a bit about the challenges and opportunities of that situation? Over.
Okay, thank you. Thank you, Sarah, and thank you for that question. So I think for us, it was really the use of peer approaches. So in our awareness creation, at least for the face-to-face creation, awareness creation, we used, members of the community that were known, within their spheres of influence. So in the markets, we worked with the Market Vendors Association. So these were already regular faces, people that already had respect from their peers and were known to always have credible information. We also used to stand up one-time youth, like I said, who were very familiar faces again within the areas that they operated. At community level, we worked with a cadre, the community mobilizers. These are community volunteers who have done other work, like in the case of the Highlands. They were part of our earthquake response in 2018. And so these are people that are well trained in engaging with communities. They've been providing psychosocial support within these same communities, responding to victims of social-related violence. So the caliber of cadres we worked with were equipped to be able to convey the message in a compassionate manner, non-threatening. But one of the challenges that we quickly noted in our awareness creation work was denial. Because in Papua New Guinea, we were fortunate enough not to have the rate of mortality that we've seen in other countries. So it was a bit difficult to promote, use of sanitizers, wearing masks, social distancing, because the communities were not seeing, this disease and what it was doing, besides, of course, the impact, the economic impacts that they were experiencing because of the restrictions that were introduced. So denial was a big challenge that we faced. And obviously, one of the quick manifestations was the escalation in intimate partner violence. So during the same time, we started to see very prominent persons getting their stories out in the public domain, and that created an opportunity for the work, because it suddenly caught the attention of our senior leaders. So we had a coalition of parliamentarians, for example, coming together in response to the national outcry around the escalating cases of violence. The toll-free call line that we supported. By the way, I didn't talk about some of this in the presentation because we're just really focusing on the markets work. But we had a toll-free line that we supported as part of the response. And in this toll-free line, again, we increased the number of staff so that at least they wouldn't be burnout, and also, upskilled them so that they would be able to deal with cases of domestic violence and partner violence. And what we noted is that because suddenly there was this upstage, government started to pay attention. So the coalition came together, and in November, for the first time, the country had a national summit on gender-based violence. Immediately, we went into Parliament, and Parliament put together a committee to address gender-based violence. So these are opportunities that are coming out of, scaled-up efforts to try and curb COVID, but also turning our attention to the things that have already been in the environment, but probably have not received the same kind of political attention. Thank you.
Thank you so much, Caroline, for sharing that. Now, we're almost coming to the end, but I have one final question here that is almost, it's too interesting to disregard. So I'd like to just open it up to our panelists. So one of our participants asked, I'm curious to know for the speakers, what has been the personal impact and the internal changes you've experienced working on this issue, as you're also women being affected by COVID-19. So panelists, would any of you like to just share a reflection around that? Please just come in if you'd like to speak. Does anyone like to have a go at answering that? Okay.
Sure. Oh, sure.
Yeah?
Let me come in.
Oh, please, yes. Thank you so much. Thank you very much. Over to you.
Sure. Thank you. I think personal impact-wise, I think I have still tried to pace myself better. Everybody has been struggling with this issue of the work-life balance, and it's become even more acute with the COVID crisis. I fortunately, or unfortunately perhaps, I don't have my family here right now, so the burden of care I don't have, but I do have staff members that are definitely struggling with that, with small children at home. So communicating frequently with our staff about how it is okay that they take time out during the middle of the day to cook lunch for their families, how it is okay, as long as we're communicating with each other, what is happening in our homes, how we are managing what we are doing, what we are not able to do. And so much better communication has, I think, evolved from this crisis within the office with the team, and also the emphasis on mental health and care. We're trying to take more fun breaks together, online by having Zoom singing sessions. There's so much talent in Bangladesh. Everybody wants to recite poetry. Everybody wants to do singing. So having little moments of joy together for the office, this is something that we are doing more and more. And also trying to pay attention to those that are quiet and trying to individually approach them to say, are you doing fine? How are things going? Because not everybody is also comfortable joining into those happy hours and so on. So we're really trying to look into the individual level and doing the temperature taking in that way.
Thank you so much for sharing that, Shoko. And I loved the way that you talked about the authenticity that we need to have in our relationships to one another, as we recognize that we face, you know, at least some of the same issues as are being faced by women collectively in our region. I believe this is a very different dimension for many of us. So thank you so much for sharing that, Shoko. And I think it's a great note to end on, that reflective one. So as we're just drawing to the end, I would just like to very sincerely thank our audience for being with us this morning or this afternoon, depending on where you are. It's been great to have you here and to have your great questions and your engagement. And I would like to very sincerely thank our panelists for all of the richness that they brought to the conversation. So thank you to Sarah, Caroline, Navanita, Shoko, and Rice. Thank you so much. And just in closing, I'd just like to say that the examples we've heard from each of the countries are really just telling us about the entry points and lessons learned on how to adapt programming and integrate women and girls in the COVID-19 response and recovery. As we're all well aware, this is still something that's ongoing, though we're still living every day. And the challenge now is how to further improve and scale up what has proved effective so far, to really learn from and reflect on what we're doing as we move forward. Gender responsive solutions to this crisis that recognize both the challenges and the specific roles and agency of women and girls across Asia and Pacific remain as vital as ever. So thank you once again, everyone, for being with us. And I shouldn't go without reminding you that you can find the report in the link in the chat. And we hope that you will enjoy it. And we look forward to a continuing dialogue, collaboration, and partnership with you in this situation. Thank you so much, everyone, for joining us. Bye-bye.